Hello all, welcome to Medical Equipment Explained. If you've ever wondered how the equipment used on you works, this is for you. Today's topic of discussion is going to be that of ventilation and ventilators. Some ventilators are life-saving devices, but most aid in the therapy of the lungs, which I'll explain more about later. All ventilators revolve around the fact that to allow healing of the lungs, the ventilator will need to do the majority of the work that the lungs normally would do. This makes it easier for the lungs to concentrate their energy on healing. Under normal condition, we as mammals will breathe in by creating negative pressure with our diaphragms. The diaphragm will pull down, opening up space in the lungs for air to rush in. The newly arrived air has lots of oxygen, which fills in the space of the alveoli, and which enters in the blood and circulates around your body. Knowing that, it was a simple leap to create negative pressure ventilators. This was a negative pressure all around the body to aid in the lungs breathing. In the 1920s, one of the first iron lungs was developed by Philip Drinker and Louis Shaw. It was first used as a negative pressure ventilator by the Boston Children's Hospital on an 8-year-old girl who suffered from polio. She recovered from respiratory failure. Another interesting fact, on October 30th, 2009, June Middleton of Melbourne, Australia had entered in the World Book of Records as the person who had spent the longest time in an iron lung when she died at the age of 83, having spent more than 60 years in her iron lung. Modern ventilators are positive pressure ventilators, which are the opposite of the iron lung. The simplest form would be that of a CPAP, where a mask is put over the patient's mouth and nose and positive air is pushed into their face, through the mouth or nose into the lungs, making it easier to breathe. Let's break down some of the parts of the modern ventilator. First, the tubing, both blue and white, but more on that later. The patient connection is where the tubing will be intubated into the patient. The humidifier, which receives air from the ventilator and then humidifies it with sterile water. The blue tubing shown here outlines the path of the ventilator through the humidifier into the patient. The humid air is pushed into the patient's lungs to assist with breathing. When the device registers that the patient is trying to exhale, a vacuum is created through the white tubing and it helps the patient to exhale. All this breathing for the patient helps the lungs because the ventilator does all the work of the breathing that the patient normally would do. Other equipment like CPAPs that help the patient to inhale but not help the patient to exhale are still therapeutic for the lungs because the CPAP is doing some of the work of the breathing for the patient. With all that being said, the ventilator is an incredible, potentially life-saving device.